Hello, as you watched us play Follow the Leader, I got to be the leader. Good morning. Good morning and welcome to Spotlight on Georgia's mental health and substance abuse crisis. Let's all applaud the fact that we're even here and we're doing this. It is so important. I have this wonderful panel here who I'll introduce, but I just want you to know a little bit about it. SAMHSA's 988 Behavioral Health Crisis Coordinating Office is hosting events like this around the country. We are the kickoff. That deserves a round of applause. First of the road show. And it's celebrating the 988 Suicide and Crisis Lifeline's first anniversary, highlighting 988 and crisis care implementation efforts at the state and local levels. So, this town hall panel discussion, we will have a discussion. We will address lessons learned, successes of the 988 implementation program first year, and showcasing how Georgia has rolled out crisis care across the state, including mobile crisis response, and discuss goals and visions across 988 and the crisis care continuum in the coming year. So we'll find out what's going to happen. You'll hear from a range of participants, including those who've had lived experiences and those providing direct care in their own voices, and we'll have a video about that. So we got a lot to go through. It's an important topic, and I know we're gonna all learn a lot through this discussion, and the good thing is you can take this information and take it to wherever you are and pass it along. So I'm excited about this. We got a lot of smiling faces here. I'm very excited about it. I do want to start by not dropping my paper. Thank you. Thank you. I wanted everybody to notice that. I want to start by recognizing a lot of you are special in this audience, but there are a couple of people I'd like to recognize especially. And I work at the Capitol. Oh, I didn't introduce myself. My name is Donna Lowry. I work for Georgia Public Broadcasting. I'm the moderator of Lawmakers, which airs during the Georgia legislative session, nightly, live, every day they gavel in. And then Lawmakers Beyond the Dome, which is another show that focuses on the laws after they've passed and how they're implemented. During that show, I get a chance to talk about everything going on at the Capitol. And over the last 5 years, I've had the chance of doing that show. I had the chance to get to know Speaker David Ralston. Powerful speaker, wonderful statesman and leader, and really nice to the press. I had to say that. But understood our job. Unfortunately, we lost him last year, but he really wanted to make sure, one of his legacies, he didn't know it would be one of his final legacies, was to implement and try to change and bring Georgia up in terms of its mental health delivery system. He really pushed that. I had many interviews with him, and each time he credited one person with pushing him to do this, because there was a lot of pushback, of course. And that person is here today, and I just want her to recognize her, his wife, Sherry Ralston. Would you stand, Mrs. Ralston? There she is. So glad you're here. The other person I want to recognize is one of the two people that Speaker Ralston knew would help be able to shepherd this through. He wanted a Democrat and he wanted a Republican. He really wanted to make sure that this was bipartisan, because really there should be no politics involved in this issue, right? And one of those people that he chose, who was a longtime lawmaker, who I would like us to recognize, is here today, Representative Mary Margaret Oliver. Would you please stand? Where did she go? I think she must have walked out of the room. She was just here, but anyway. Where is she? Okay, well, if you see her, please thank her for all that she's doing. She had a tough year this year, and maybe, I don't know if we'll get into any of that, right? All right, so let's get started with introductions with some wonderful people here, beginning with Monica Johnson, who is director of SAMHSA And she represents the 988 Lifeline from the national and federal level, and she shares the role that SAMHSA plays in supporting 988 in crisis care at the state level. Please welcome Monica. I'm going to introduce everybody, and then we'll come back to you. Commissioner Kevin Tanner, who I've had the pleasure of interviewing many times before he became commissioner just 6 months ago, but has hit the ground running, is doing a wonderful job. And he's going to speak on the rollout of the 988 system, its benefits in communities across Georgia, and not only in urban and suburban areas, but certainly in rural areas. So welcome, Commissioner Tanner. Kim Williams is President and CEO of Vibrant Emotional Health. She represents Vibrant's role as the administrator of the 988 Suicide and Crisis Lifeline, funded by SAMHSA, which provides 24/7 support for people in emotional distress. Welcome, Kim. Kyle Inhofe, I'm sorry. I got to everybody but you in terms of pronunciation. He is Deputy Executive Director for the Veterans Crisis Line, VCL, Veterans Affairs, and he provides leadership and oversight for VCL operations, including crisis operations. Thanks for being here. Christine Cuellar, she is the Deputy Director of the Georgia Crisis and Access Line, and she provides leadership for GCAL and is passionate about working with underserved populations experiencing mental health and substance abuse issues. Welcome, Christine. You guys are not in order, so raise your hand. Okay. When you followed me in, I thought you were all in order. Okay. Selena Popovich Evans is Director of Region 4 Mobile Crisis, the response team for Benchmark Human Services, and brings extensive experience in community mental health and substance abuse. Welcome. You raise your hand so people know who you are. Okay. Lori Holbrook represents the unit that serves as the Chief Clinical Officer, I should say, for Avita Community Partners. She represents the unit that serves both suburban and rural parts of North Georgia. Welcome, Lori. Jolynn Matheson is a peer specialist on the crisis unit at Avita Community Partnership. She is going to share lived experiences with substance misuse and mental health, including 2 experiences in the crisis unit. Welcome, Jolynn. And Elvin Gittens, he is a certified peer specialist on the mobile crisis team with Behavioral Health Community Link. He'll share experience and passion for going out into the community and using his lived experiences to support individuals and families in their moments of crisis. Welcome, Elvin. That is a panel, folks. Pardon? Okay. Did I miss somebody? No. Oh, Mary Margaret Oliver's back. That's what she was telling me. Representative Oliver, I did this big build up to you, and then you weren't here. Please, a big round of applause for Mary Margaret Oliver and all that she does down at the state and has for so many years. Okay, thank you so much. I'm not real good with whispers, okay? Ask my husband. Yeah, he's like, I don't have to talk that loud. Anyway, let's get started. And we're going to start with the lady who is helping me with all of this. We have prepared remarks right now from the person from Monica, who is with SAMHSA, and she's going to tell us a little bit about why we're here and more.
Good morning, y'all. I get to say y'all here and not be uncomfortable. I'm back home. So, yes, so for those that don't know me again, I'm Monica Johnson. I'm the director for the 988 and Behavioral Health Crisis Coordinating Office at SAMHSA. And y'all know that before that, I was here at DBHDD for a long time. And so I'm so excited to be able to kick off this tour in this state. I want to first acknowledge Commissioner Tanner for continuing to lead the work that has been happening in this state related to behavioral health. Y'all are gonna think I'm biased and that the reason why we are in Atlanta first is because I'm from the A, but that's not why. It is seriously because when you're doing the work, So when I think about my time at the department, my time in the community here in this state, I've done this my whole adult life in this state. So it's obviously special to me, right? But when you lift up and you get to see from a bird's eye view, and you get to see the entire country, and you get to know how other state systems are working, and you get to see the different places that states are in as they're trying to think about their behavioral health crisis systems, I know without being biased that this state is a star. And this state is one that should be lifted up as an example, and it already is. So before I tell other people, you should just go ask Georgia, they were like, we already knew that. We already knew to ask Georgia. That's kind of why you're here. So, I mean, I want you all to really sit with that, though, for a moment, because I know how hard you work, no matter what role you're representing today, no matter what position. Everybody works so hard, you don't often get a chance to just lift up and recognize the progress, because we're always thinking about what's next and what do we have to do to fix something or address a crisis. But what you don't get to see is that over the decades since this department was born, there has been phenomenal work that puts this state in an advanced stage in terms of this building this critical work. So it is my absolute honor, my pleasure, and with so much pride that we start off this tour, which is to celebrate the 1-year anniversary of 988, which was coming pretty fast on July 16th. And so knowing that even in a state like this state where it is just held up in such high regards in terms of the work, even in this state, I know, because I know the people, you're still like, but we gotta do more, and there's more we gotta fix, and we gotta do this. And you will do that, and you'll continue to be the example to help lead this country in terms of figuring out how do you do this very complicated work. I'll end my remarks with, while we're obviously talking about the crisis system and the importance and the just transformational moment we are in as it relates to 988, the one thing that is happening that is a phenomenal thing, and I don't think it gets lifted up enough, is that I think this is the first time that I can recall in at least 26 years of my career that every single state and U.S. territory is talking about their behavioral health crisis system, which then leads to talking about access, talking about equity, talking about all the things that are needed to create a full continuum of care. We will get this right. We will. It's going to continue to take the hard, dedicated work of very smart, diverse people that will come together and lift this work up and say, we will no longer just be okay with accepting mediocre at its best. Behavioral health systems, often we look at behavioral health so much differently than we do physical. We're going to lift that up, and it's going to be equal, it's going to be the same, it's going to have the same parity. We're going to continue to push this system so that when you, your neighbor, your family member, your child, your friend, your spouse, your partner is in need of supports for a mental health crisis, substance use crisis, or is struggling with thoughts of suicide, that our system responds quickly, effectively to get the outcomes that people deserve. So thank you all for allowing us to showcase Georgia as being the #1 place and why we started with you all. Thank you so much.
Yeah, thank you. Thank you, Director Johnson, for getting us started. Now I know prepared remarks you also have Commissioner Kevin Tanner, who is the Commissioner of the Department of Behavioral Health and Developmental Disabilities. Let's hear from you, sir.
Thank you so much, Donna. You know, as I think about being back with Monica here, and I think about the remarks she just talked about Georgia really being a leader in this area nationally, you don't have to look too far to see that, because the federal government realizes Georgia's leading in this area because they come and poach some of our best employees. So thanks a lot, Samsa. I will say this, we're glad to have Monica where she is, but I encourage SAMHSA to keep their hands off of the rest of the DBHCD employees. But we are honored to have Monica with us today, the director, and we appreciate her leadership, both the foundation that she helped lay here in Georgia, but also the foundation she's going to be able to lead nationally in this area. And it also helps to have someone living here who has got the ear of leaders in Washington and across the country continue to lift up the great work that's happening in Georgia. Also, as I look around the room today, and I see just so many rock stars, people who work for DBHDD, people who work for our providers, and really people who have been in the trenches in this work for a long time. Because, you know, one of the things Monica talked about was Georgia didn't start this work July 16th of 2022. If we had, we wouldn't be here today talking about Georgia being in a leadership role in this area. You know, one of the things I do outside of being and have done outside of being in government service is being a developer, being a builder. And I will tell you, when you get ready to build a house or you get ready to build a commercial building, you don't just start digging and you don't start nailing wood together. The first thing you have to do is you have to design it. You have to create a blueprint. You have to create a plan of what that's going to look like. Georgia has done an outstanding job over the last couple of decades of creating a blueprint. Now we're able to execute and we're able to build the house that so many in this room are responsible for helping design, and we're going to make it happen. Since 988 was stood up July 16th, we saw approximately a 12% increase in call volume into our crisis line. Georgia has been fortunate to have a crisis line for 17 years. We had a 1-800 number. It went to GCAL. 988 obviously is much easier to remember, so we're seeing increased call volume. But another interesting statistic, since 2019, so pre-pandemic to 2022, we had an over 40% increase in the call volume to our crisis line, and over 40% increase since 2019 to 2022. That's a tremendous need and an increase. And since 988's been stood up, it's been a 12% increase. And this is without any real marketing campaign. Once the marketing starts, SAMHSA and our federal partners predict that we'll see a doubling of the call volume. We have to be prepared to handle that, because it's not just about someone answering a phone call that's able to triage your needs, but it's about the whole crisis continuum. It's about having someone that is able to respond out and meet you where you are to provide service. It's about having a safe place to go, whether that is a provider in the community or whether it's an inpatient hospital bed or a crisis bed. Whatever it is, the entire system is going to have to be built out. Our prediction is Georgia will need 500 additional crisis beds to be able to meet our future needs here in this state. That's a lot of work still ahead. So we want to celebrate where we are, and we want to recognize that we're standing on the shoulders of some great leaders, but we still have a lot of work to do. So we're rolling up our sleeves, and we want Georgia to continue to lead in this area. But we're excited about where we have been, we're excited about where we are, and we're really excited about where we're going. Georgia's going to continue to lead in this area. Also, again, I just want to again recognize our staff here. We've got some tremendous programs going, whether it's dealing, and one of the things too I want to mention that may surprise some of you in the room, since 988 has come online, we have seen a higher call volume coming from our rural communities than we have from our metro areas. We have seen an increase in the number of suicides here in Georgia coming from rural Georgia, when we've actually saw a decrease in some of our metro areas in suicides. So we know the challenge in rural Georgia and across really America, rural America, is a lack of access. Many parts of our state are having to drive well over an hour to access care and services. We also know that stigma is much higher in rural parts of our state. So those are all challenges that we're trying to address as we continue to look at the host system. And Monica likes to talk about, and I completely agree with her, it's not just about one piece. It's about intervention, early interaction. It's about following up. It's about folks like Logie here in the room who are leading our forensic peer effort within our prison system. The entire system is going to have to work together for us to be successful. So, Donna, thank you for being here. Monica, thank you for your leadership, that I get the opportunity to stand on some shoulders of some great folks that have gone before me. And thank you for holding up Georgia as a great example. Our employees at DBHDD and our providers, thank you for all you do.
Yeah. Thank you, Commissioner. So Director Johnson, I'm going to go back to you. You have a unique perspective on this because you were here when everything rolled out in Georgia last year before you were poached to work at the national level. So I want your perspective on what that transition was like for Georgia and what were the key accomplishments you worked on that were able, you were able to see actually happen.
Yeah, so I would be remiss not to just call out some specific names. So there are some key leaders here that work tirelessly behind the scenes, day in and day out to get this ready. Debbie, before she was poached for somebody, so Debbie's there. Wendy, Dawn, Anna, we're working day and night, over and over, trying to prepare for this. And then, of course, all of our partners at BHL, GCAL partners, to make sure that we can have somebody available to answer the phone. And that hard work paid off. And so, like many states, and across the country, what we're seeing is that our initial goal is, if you dial 988, can somebody answer the phone? And we've seen that Georgia, as well as across the state, that is happening. And so we'll be quickly thinking about, just as, I was just here, right? Like you said, just last summer, last fall, and into the early winter. And I was thinking about this then, and I don't think anything's changed. And I think this is true for the country and the territories, is people are quickly moving then, so then what? What happens after that? And so what does mobile crisis look like? What if I ended up calling 911? Because people are still going to call 911 for instances, because there are still going to be appropriate times for that to happen. And so that interface between law enforcement and 988 is going to be very critical. And so how do we work together? This state has great examples of what we call co-responder models. You're starting to see a lot of that being developed across the country, where law enforcement are working very closely with behavioral health professionals to be able to jointly address these needs. At the end of the day, I think all parties want, when somebody's experienced a behavioral health crisis, that the appropriate intervention is provided. And so I think we have a lot of work to do there. And then, of course, a safe place to go. And so what does that look like? Here in Georgia, it may look like a behavioral health crisis center, which has some emergency walk-in capacity, assessment ability, and crisis stabilization beds. But there's also peer respite opportunities. There are other things that can be infused in the system. And so I think, again, taking those learnings and looking at helping guide other states as they're thinking about that whole continuum. You cannot build a crisis system on a broken foundation. So those other parts of the system, your general, I just need to see a doctor, I just need to see a therapist, like the fundamentals, how do you access that? Do I call and I still have to wait a month to get an appointment? Like, these are the things that are foundational. And so building a system only around crisis will have cracks. And so I think that's the work that we have to do as a country, and the work that you all are going to continue, I believe, to do here.
We had people submit questions from the audience ahead of time, and I want to give this one to you right now. This is from Sue S. She said, since the transition to the 3-digit number, is the growth of 988 at the level that was expected?
So Commissioner Tanner alluded to this earlier, and I'll say a little bit more about that. So we have not done mass marketing. And so when I say mass marketing, you're thinking about commercials, right, that you see on TV all the time, or a national ad campaign where there's media everywhere. There's all types of, you can't go anywhere without seeing something about that topic. We have not done that. We weren't initially funded to do that. And so this is going to be like, when people ask me, well, what do I see on the horizon, kind of what's next? It is getting the word out in a more marketed way, in a more focused way, to be able to get to the priority populations and the people that we know that we probably aren't necessarily reaching right now. This cannot be a program based on word of mouth. And so we have to make the investments and able to do that. States will have to do that. We'll have to do that at the federal level. And we want to be good partners with the states and work together to make sure that we can use collective resources to be able to lift up that this is available.
Okay, thank you very much. Kim Williams, you are here today representing the National Administrator for Lifeline, Vibrant. And can you talk to us about some of the challenges we've been able to work through and overcome in the last year?
Good morning, everybody. It's a pleasure to be here. First, I just want to say thank you to federal partners, state partners, local partners, the crisis centers, providers, persons with lived experience, family members. We are just so grateful for your collaboration and commitment and partnership to the 988 Lifeline service, and we're honored to work with all of you. So the biggest challenge that we had to overcome was ensuring that we could respond to an increasing volume of contacts and to be able to respond to people in a shorter period of time. The average speed of answer this past April 2023 was 37 seconds. A year ago, it was just under 3 minutes. That is a significant improvement. And then if we look at a comparison of the number of contacts from April 2022 to April 2023, we had 160,000 more contacts, and we were able to reach people more quickly. Our call answer rates improved by 50%, our chat answer rates improved by 90%, and our text answer rates improved by over 1,000%. We so far have seen 3.6 million contacts in this first several months of the service. In the calendar year 2021, that is the number of contacts that we received, and we're still, not at the end of the year. So we're seeing more people reach out, and as the administrators, we have been able to both be able to respond to the increasing volume and also be able to reach people faster. And that was our commitment, and we were able to work in partnership with the crisis centers around the country, ensuring that we were getting them funding so they could build out their workforce and also improve the user experience. The other thing that I will just add that wasn't so much a challenge but is a major priority for us is really ensuring accessibility of the service. Ensuring that as we continue to partner with SAMHSA in building out this resource, that we are expanding the services that people can access when they reach out. And I will touch more on that later. Thanks.
Thank you very much. I want to go back to you, Commissioner Tanner. I want to ask you about the impact our state has had over the last year. What effects has the 988 expansion had in the state of Georgia this far?
Well, as we continue to see call volume increase, I think even just by the word of mouth, we're seeing a 12% increase in the last year in the call volume. The other thing that it has done is I think it's renewed the conversation. One of the things, and Monica hit on this earlier with the late Speaker David Ralston, and last year with the passage of House Bill 1013, the Mental Health Parity Act, we really was able to launch Georgia and Georgians and political leaders and policymakers in a place that I've never saw the state in before, where we're really having an honest, open conversation about mental health. And because of that, I think we're seeing stigma decrease. And I think 988 is a catalyst to lowering stigma around this system. So as we continue, I was thinking as Monica was talking today, just from the publicity that this event today will get, we will see a spike in the call volume at 988. Anytime there's a newspaper article, we see a spike in call volume. The more we talk about 988, the more we promote 988, the more we decrease stigma. And that's healthy for Georgians to understand it's okay not to be okay, and it's also okay to seek help. And I think that's what 988 has really been able to bring the conversation to a new level.
Yeah.
Can I jump in?
Yeah, sure.
Can I jump in there? I just want to really underscore the importance of what was just said. Like every time, like you said, when we are talking about it, rather it's because of this event or whatever the venue is, people then are responding like, oh, I didn't know that existed. Like, this is something that I can use. And so while we have the capacity to answer the calls that we projected to come in, and it may be a little under that, it's still more, as you heard from both Kim and the commissioner, that it's still more than it was before 988, and that's important. So we are reaching more people. We just want to continue to reach even more because we know that the demand is there. People just got to know about it. So tell a friend when you leave today.
That's right. We want to broadcast this everywhere. And by the way, I'm recording this for Georgia Public Broadcasting, so we'll have some radio stuff on this. Commissioner Tanner, I want to stick with you for a second because you and I have talked about this, and you're a farmer. You come from a rural area. Can you talk a little bit about the concerns in terms of mental health when it comes to the farming community?
Yeah, we have a disproportionate number of people in the agriculture community in Georgia who commit suicide every year. It's not something, as a person who comes from a farming community, my family's been involved in the poultry industry since it started in 1950 and have been farming in North Georgia since 1800, and I own a poultry farm personally, so I'm around people in the farming industry all the time. And when we get together, we don't talk about our feelings. Farmers do not get together and talk about their feelings. You're viewed that you need to be a tough person, that you need to be non-emotional, that you're an overcomer and you're just a worker. And what happens so oftentimes is that person bottles up those emotions until they can't do that anymore. And that's what we're seeing in our agriculture community. And one of the things, too, I think a lot of people don't realize is, a lot of us go to work every day and we get a paycheck every 2 weeks. We know exactly what it's going to be. And if you do a good job, you're going to be successful. In the agriculture community, you can do everything right, but you've got a bad winter and your peach crop's gone. You've got pests and bugs that come into your farm, and your entire livelihood is wiped out. So the agriculture community faces challenges that a lot of people just will never think about. One of the things I think is important, and I try to do this with my friends who are in this industry, is listen to what they're saying, because you can pick up on those context clues. And we also need to continue to remind people, no matter where they are, that it's okay not to be okay, and it's okay to ask for help. But I also think it's important to understand the best person to reach these people is their peers. Just like what we're seeing in recovery, in the mental health space, in the forensic space, a farmer will listen to a farmer. They're not sometimes going to listen to someone else. So it is real, but we're seeing an increased number of farmers calling 988, and that's a good thing for Georgia.
Yeah. Thank you so much for sharing that. And I think it's an area that a lot of us are unaware of. So I appreciate that. I want to talk a little bit about veterans now. So Kyle, let's talk about that. You're going to pronounce your last name again for me.
Inhofe.
Inhofe.
Yeah.
It sort of looks that way. I'm sorry. I keep messing
That's
it
all
up. So Mr. Inhofe, how is VCL meeting the critical needs of veterans in Georgia?
So it's interesting to hear some of the different things that have happened and some of the statistics that I've heard up here, because we're kind of mirroring those. It's been interesting too because I started at the VCL in October of 2021. And my boss, Lisa Kearney, at the time, I asked her, you know, what are some of the goals that we have in VCL and what are some of the things that we're working toward? And I previously worked with VCL some on the kind of as an admin support through human resources. So I knew about VCL, but I didn't know exactly what VCL had going on. So I asked what some of the goals were, and she said, well, we're going to implement a historic 988 initiative here in about 6 months, and I need you to hire 1,500 people. And I was like, okay, anything besides that? Is there any other things? So I really just got in and right in the middle of it. So it's been very exciting to be part of, and hearing some of the prep work that we did, and I'll be honest and say that the VA has provided the Veterans Crisis Line a lot of support. It's one of the Secretary's major goals across VA, so just having that level of support has been just really important to us. And the VCL actually provides services to not only veterans, but actually active duty service members and their families as well, for them to be able to call. So just historically, just want to provide a little bit of information that the VCL started in 2007 with only 12 employees in Canandaigua, New York. We actually expanded to add employees in several areas, including Atlanta. We have a location here. And we have actually a large number of employees that reside here in Atlanta. Prior to the implementation of 988, we expanded up to 1,400 employees. And then January of last year got approved for 2,568 employees because of the things that you're talking about. Not only the increases that we've seen since the rollout of 988, but what we're expected to see, the continued increases. We have seen similar increases, what you mentioned. We're about 13% increases overall in the number of calls. What's been really interesting is, because we have chat and text as well, our chat is about 10%, but our text volume since the implementation of 988 has gone up by over 40%. And in recent weeks, if you compare the text volume that we have compared to the same time as last year, we're fluctuating between increases of 85 and up to 125% in text. So that's been a real focus for us to look and see what we can do to manage that workload and continue to partner with SAMHSA and with Vibrant and with the local communities to make sure that we're able to provide for those that want to reach us. And just wanted to add one last thing with those increases that we've seen in our workload, just to put numbers to what it actually means. So between July of last year and May 8th, the VCL has received an additional 55,000 calls. We've received an additional 8,707 chats and over 18,794 texts. So the work that is being done actually means something. These numbers are actually people that we did not reach the year before. So all the work that is being done is truly making a difference in people's lives.
Can you, and maybe you or somebody else can help me understand? I didn't know that texts were a possibility.
Yeah.
How does that work when you call 988?
Yes, so
You
for
wanna take it?
988, you
Yeah.
can text or chat now.
Yeah.
Wow,
So you
okay.
can call, you can text, or you can chat. And then,
Yeah, that's right. So if you text, for veterans specifically, when you text 988, there's a message that comes back that says, if you are a veteran, we have a different number that you can text. It's 838-255. So we have people text us through that. And to me, the text option is very meaningful to me because I think there are times where people just are afraid to call. And I know personally, I have 2 teenagers, and I don't know about you guys, but if I call my teenagers, they don't answer, but they text me and say, "What's up?" So I think it's just that's the future, I think, and So that's a big focus that we have within VCL.
And I think it's great that, looking behind you, that you have text, call, and chat up there for those of us who didn't recognize that it was, we think of it as 911, right? Which you call and not text, right? Unless I'm missing something. But so I'm glad that we're drawing attention to that and that's a part of the publicity that you're trying to get out there. Thank you so much. Let's talk to you, Selena Popovich-Evans. Can you share about your work in the rural crisis mobile support units? How do you see mobile crisis making an impact in the communities?
So mobile crisis in the communities, we can really only be successful.
Is your microphone on? Let's see. Okay, just a little louder.
We can only be as successful as we are connected into the community. And so for us to be successful, we have really good, strong relationships with all of our community partners. And there are a couple of examples that I can give that show how that works out for individuals that we serve. We had a young lady who had some significant mental health problems, and she called the crisis line quite often. Once or twice a month. And so what we did was, and she went to the emergency room too, what we did was we were able to get together with the individual, with a representative from the emergency room, with people on their care team at the community mental health clinic, and all of us together were able to work with that individual to develop a crisis plan to help them be more stable in the community and have less hospitalizations and less crisis calls. None of those things can really be done on our own. So that's really important. And another example that I can give about, being connected into the community, and is going to be a young lady. She was about 16, and she was in foster care, and she was living in a migrant community, only spoke Spanish, and she was working and taking care of herself, but she did not have parents here. And so DFACS had taken her into care and placed her in a foster home. However, the foster home she ended up in was a home that did not speak Spanish at all, and she was put in a different county in a school that didn't have those kinds of services, and so in terms of language and such. And so she became very isolated, and she became very depressed. And when one of my peers went out to see her, who happened to be fluent in Spanish and understood that community, she just lit up. She was so happy. She was so excited to just to have somebody who could communicate with her. And so from that, we were able to advocate with school and with DFACS on her behalf to get her into some services and get her maybe a better placement where she could feel like she was a part of community and not cut off from everybody who supported her.
Yeah. Thank you very much, and I'm glad you brought up the need to have people who can relate to people in various communities. So we've heard from rural, so Mr. Gittens, we're going to hear the urban side of the mobile crisis a little bit here.
Absolutely. Can you all hear me? Thank you. Good morning, everyone. It is truly, truly a great opportunity to be here speaking this morning for something as important as the 988 rollout well, it's a 988 rollout for the country, but I'm in Region 3. I'm a certified peer specialist in Region 3. So my experience.
What does that cover?
I'm sorry?
Region 3.
Region 3 covers pretty much all of Metro Atlanta. So that's everywhere from Riverdale to Alpharetta, from Decula to Decatur to Covington, all these areas. It's interesting, when I was putting together notes for today, and I was using an app speaking to text, and I said Decula, and the app heard tequila, which it's okay.
It's Friday.
It's absolutely fine, because being on the mobile crisis response team, we do respond to substance use calls as well. So a lot of times we're able to go out and help these individuals and these family members that are in a place of crisis, but that crisis is coming from substance abuse. So we're able to link them with services, inpatient, outpatient services. A lot of the time we do utilize the SAMHSA helpline. That SAMHSA helpline is important with providing them the proper resources, inpatient, just resources in the area. So it could be something as simple as an AA meeting, and we're able to use that for them. We're able to provide that for them. So I mentioned earlier my experience working mobile crisis and how much we see how 988 has changed the environment. Commissioner Tanner, he mentioned about a 12% increase in calls since the 988 implementation. And I can say, I have a few of my teammates here today also with mobile crisis, but we can definitely tell you that we see a great increase in the demand and the need for crisis services in the urban area. So we respond to schools, we respond to defects settings, we respond to group homes. And the great thing about 988, with the agencies, so much like defects and the schools, we see it where they're the ones that's going through and using 988 to get the services for the individuals. We also see it with law enforcement. Law enforcement will reach out to us, and they've utilized that 988 number also, which I think is really great because with law enforcement reaching out, it's taken away the criminal aspect from mental health, you know, and now they're putting it back to where these individuals can really get the support and the care that they need instead of going through a court system, you know, trying to find services for them. There's a saying that we have in the mobile crisis world. It says, crisis has no schedule. And, you know, crisis has no schedule, but it also has no boundaries, right? It doesn't recognize age, it doesn't recognize ethnic group, race, any of those things. So we may respond to school, and we're going there to speak to a 6-year-old about suicidal ideations. We may go out to a home, and we're going to speak to a grandmother, a grandfather that's having a rough emotional time, an emotional crisis. So we really see the need. We see the increased demand for the service. I mentioned that a lot of calls are generated by agencies, and when we go out, one thing that we always tell the individuals, the families, you know, if you need to call us out, I know we came out today, that doesn't mean that you can't utilize us again. And just dial that number, dial that 988, and they're relieved because they don't have to go through the 10-digit number. It's just three digits to remember, and you know, they feel more empowered to reach out again, knowing that, hey, it's a quicker number, quicker response, and you know, help is just a phone call away. So increased need, increased demand, but a faster way to get the services that are being offered to them. So yeah, that's my experience with, you know, working mobile crisis in Region 3. As a certified peer specialist, I do take to the job, I do take that lived experience, you know. So when we go out, you hear me say individuals a lot today. That's how I see these people. I see them as individuals. I don't see them as a diagnosis. They're not a label. They're just individuals. So that's what I bring to them, being able to offer them that support from a place of understanding. Thank you.
Thank you. You all are doing such great work. Let's go to you, Christine Cuellar. A little bit, I'd like to go over your perspective on what it's been like working in the Georgia community to provide mental health crisis services. Specifically, how is 988 changing the way you're able to provide care in Georgia?
Sure, thank you. First, thank you for having me here today. I feel very blessed to be part of this panel. And hearing the perspectives of the people up on the stage is wonderful, because being part of the Georgia Crisis and Access Line, we touch a little bit of all of you. So for GCAL, for years has offered the opportunity to connect with our community in a very significant way. Being able to talk with individuals who have very limited access or no access to behavioral health resources, or connecting with that individual in the community who's experiencing a crisis at that moment, and then having the ability to get them some services immediately is such a rewarding place to be able to work from. Since 988 has rolled out, I would say it has given us such an opportunity for growth, providing us with a much larger platform that's easily recognized and utilized, and allowing us to reach a much larger percentage of the Georgia community. So it's been a wonderful growth opportunity.
All right, thank you very much. We may get more from you a little bit later. Let's move on to Lori Holbrook. Can you tell the audience about your work with Avita Community Partners and the impact you've had? You've been able to witness what's happened since last July with 9/8.
Thank you. I'm really excited to be able to share this because it is unique. Coming from a behavioral health crisis center, as the director of that unit, I have a front row seat into seeing the connections that people that are experiencing behavioral health, mental health, substance abuse crisis be able to be connected to the level of care that they need when they need it. So, and I've been in this field for about 20 years, so I've seen that change, how it's morphed, how it's become what it is, so that when individuals make that phone call, I think what we find, or I have found in the field, is that people tend to wait a long time before they reach out. They struggle, which is human nature. They're working through it on their own. They want to try to not burden other people due to either the stigma. There could be many reasons why they don't reach out. The fear of the unknown, the fear of a previous experience that they may have had when they reached out. But now what we find is that when they call 988, they're actually able to speak to someone so quickly that I think of it like the person's recovery journey begins with that phone call. And when they make that phone call and there's someone on the other end that no judgment zone, to accept that phone call and then to connect them with whatever that may be. It may be with an outpatient center. It may be working with DFACS or the school. It may be needing a crisis stabilization unit. There's now part of the continuum covers so many options for individuals, whether that's peer support, or working with a clinician, seeing a psychiatrist. There's just so many options that were not really available before. But the other thing that I think is very helpful to individuals that are struggling and they're experiencing that in that moment is that we want to divert them from being stuck in a system. They may need to go to a local emergency room, but they may not. And if they don't need that, we want to be able to remove any barriers that gets them to the final place that, is going to help them wherever and whatever that may look like, the right place at the right time. And I think that one of the benefits of going almost last is that a lot of people have said so many wonderful things, and I really want to underscore as well, what you have heard is this golden thread of partnership. And I just can't say it enough because none of us, or even us as entities and organizations, could do this without the relationship that we have, the relationship that we as a behavioral health provider have with our local emergency rooms, with the school systems, with DFACS, with GCAL. Keeping those connections also helps the individual. We're able to wrap around services, wrap ourselves around that individual so that they realize that not only they are not alone, but we're not. More eyes on the situation is only going to help everybody. And when they make that call, when we connect someone to help, they get the help they need. We didn't just change their life, but we changed everybody around them, their families, their loved ones, their friends, their communities, which we are all a part of. So it really is not just a ripple effect, but it really does touch so many more lives than I think people might realize. When they're making that phone call and that other person's on the other end talking to just them, they're really talking and impacting the lives of many, many others.
Well, certainly what I'm hearing here is definitely a collaborative effort as you all are talking. We didn't forget you, Jolyn, and all of this. Jolyn Matheson, I understand you work on a crisis unit and that having this firsthand view of our crisis care continuum, so you really get a chance to see it up close. Can you speak to how you feel Georgians are being cared for?
Yes, ma'am. I also want to say thank you for having me here. It's an honor to sit with all these people up here on this panel. So I am a certified peer specialist at Avita's Crisis Stabilization Unit. Lori is my boss, and I love her.
And I love her.
So at our Crisis Stabilization Unit, in my position, I get to walk along the side of our guests as they take their first steps into their recovery. And that, for me, is an honor. It's not a job, it's not a career, it's an honor. And like you heard me say guests, we don't call them patients or clients, we call them guests, because a guest is a welcome visitor. And that's what we strive to do at the unit, is welcome people as they are with no judgment, and to just to welcome them with no judgment. That's a big thing for me, because I've lived that and I've had the judgment. So, you know, when our guests come to us, it's quite possibly the worst day of their life, you know? They're at their lowest point, and they're just looking for understanding and compassion and empathy, guidance, and most important of all, they're looking for hope. And for me to be able to provide any of that is an honor, because somebody provided that for me at one point in my life.
Thank you so much. I knew you were nervous about being up here. What beautiful words. Thank you for sharing that with us. I appreciate this. Yeah. You deserve that, because you did a great job of explaining that, and we're so grateful for what you're doing. Mr. Inhofe, I'm going to go back to you to talk about veterans a little bit, and the 988 Press 1 option, expanding to provide additional support in the Georgia and future. So what does that look like?
Yeah, that's such a great question, because it's not just what we've done to get here so far, but what are we going to do next because of the anticipated even more growth that we're expecting to see. So obviously one of the big things that we're going to continue to do is the hiring surge that we have. I mentioned that we had 1,033 employees when I started, and the last I looked, now we have 1,777, working toward 2,568. Like I said, we just have tremendous support from VA and VHA leadership. We're looking to get the word out among the veteran community, so veteranscrisisline.net we have a lot of resources there that people can use to share the word. I think that's a big thing that I've heard a lot of today up here too, is just sharing the word. I was actually talking to my Uber driver on the way here about how he heard of 988, and we actually had a nice discussion, and he said he was going to share in the way that he can as much as he could, so it's really great. Another thing that's been really interesting in working with SAMHSA is for Spanish-speaking veterans, so the first option is for veterans, the second option is for Spanish speakers, but we have Spanish-speaking veterans, which wasn't really something that we anticipated being something that we really needed to consider, because what we've learned is that people in crisis revert back to their native language. So we're working very closely with SAMHSA and with Puerto Rico in particular to see how we can do a really nice handoff from SAMHSA when we have Spanish-speaking veterans, so that we can get them in our system. And there's so much other support that VA has after the call with the suicide prevention coordinators and get them in care after we get them through a situation on a call or text or chat. And then obviously the biggest thing that we're working toward, like I mentioned before, is because of the large increase that we're seeing in text, we're really working, receiving a text and the things that you do to help an individual through a situation where the text is different than calls. So we're really doing a lot of training to make sure we're staying ahead of the demand to make sure that we have plenty of people available to answer texts as they come in. So all those things together and everything that I've heard up here is just really a continuation of just hearing more preparation, getting more people ready so that we can outreach as many people as we possibly can.
Yes, absolutely.
So this partnership is just really critical. Our administration prioritizes veterans, and so the collaboration that we have on a federal level is meant to translate to a state level. And so we want a role model what that collaboration should look like. And this is one of our key ones. And so I do want to just pick up where, because you led with the press 1 for veterans if you call 988, press 2 for Spanish speaking, and 3 for LGBTQ youth. And so we want to make sure that those 3 priority populations do have access. We've seen in those communities higher incidence of suicides and the need for support. And so those are our priority populations, and just wanted to finish the 1, 2, 3.
Thank you so much for that. We're going to now show a video for those of you who in the back who thought we were supposed to do that in the beginning. That's my fault. I apologize. We're going to play that video now, and then we'll start kind of wrapping up and kind of looking ahead. So let's see that video.
We all kind of have some lived experience, right, with behavioral health in some capacity. We have a system where this was my family member, I want them to be able to go here and get the help that they need.
So Georgia's crisis system is able to help set the stage for the national level because we have been building Georgia's crisis system for 15 to 20 years.
Our crisis system was the first that met people where they were physically at. And not just physically where they're at, but culturally where they're at.
I can pick up the phone and call 988, and I can access someone who is trained and dedicated to serving me and folks who are in need. That becomes the easy button.
If you call 911, the fire department may show up, or the ambulance may show up, or law enforcement may show up, not necessarily trained to handle mental health emergencies. 988 is the answer.
Our system is multifaceted. We have a 24/7 call center, and people that call into that call center have an opportunity to talk to someone who can quickly assess their needs. Sometimes the person requires a mobile crisis team. They respond in regular automobiles, in their car, they're in plain clothes. When a person's experiencing a crisis, they really need privacy.
We want them to be able to access help as soon as possible. We want to divert them from any unnecessary engagements with law enforcement or from spending hours in an emergency room waiting for a crisis bed.
At Avita's Behavioral Health Crisis Center, individuals receiving service here are referred to as guests. We want people to feel welcomed here, and we want them to feel as if their needs are met and they are started on their path to recovery.
My recovery to me is freedom. You know, it's freedom from the stigma of my diagnosis. It's freedom from my addictions. And that is what allows me to sit with the people that we serve and be exactly what they need, because I know that's what I needed when I was in my crisis.
There's a lot of people that are really scared to really even say that they need help. One of the things that DBHCD is doing to engage our community is really having them have a seat at the table. And for me, as a person of color, like that is such an important piece for me.
I sit here feeling super, super proud. You know, proud of the system that we have, proud of the providers that we have.
So the more we have these conversations, the more we talk, the more we improve the system, the more we promote what we're trying to do, I think it allows people to know it's okay to ask for help, seek the help that you need, because there's brighter days ahead for you.
Let's have a round of applause for that video.
Right, with behavioral health in some capacity. We have
And
a
while you
system
didn't see it
where
at the beginning, I
this is my
think it all,
family
it
member,
really
I want
kind of
them
brings
to
things
be able-
together. We have another video at the end too, so that's coming close by after this. Commissioner Tanner, I want to ask you, as we look overall, as the state goes forward with 988 and the crisis care continuum, to talk a little bit about what that looks like.
Well, like we talked before, with the estimate of needing 500 additional crisis beds to really build the system out, we know that we're going to have to increase the number of call takers we have. If our call volume is going to double, we're going to have to increase the number of mobile crisis teams. The SAMHSA has set the goal of being able to respond, I think, 80% of the time within 1 hour by 2025 in mobile crisis. So that is a challenge that we've got to step up and be able to meet. And then being able to have a safe place to go. You heard our partners with Avita talk about their crisis center. We're doing a lot of work around certified community behavioral health crisis centers and upgrading our CSBs to that model. So we've got to continue to build out this system because we're going to be encouraging people to hit the easy button. We got to be ready to respond because there's no wait list. There's no time to wait. When someone's in crisis, they need help. And we have to be ready to respond. So we've got a lot of work to do in Georgia, but we've got a team that's up to the challenge. We have a state that's having a serious conversation, and we're gonna continue to be a national leader in this area. And I'm just excited to be able to be a small part of that.
Okay, thank you. Director Johnson, that same question, basically, the future with 988 and your vision and goals for the future.
Yeah, so it's really important. We also talk about how you pay for this, right? And so the money matters. And I'm proud to say that the level of investments, close to $1 billion that this administration has provided towards this work, I think sets the precedence of how important this is. Just within the last couple of days, maybe, SAMHSA has released new funding opportunities for states, roughly $200 million, about $200 million, and you'll see that we're continuing to be what we think is your startup support group, right? And so get this money infused into the states and so that you can do the things that Commissioner Tanner just talked about. But at the same time, also be looking at, well, what is our local need and how do we fund that? And so our priorities are continuing to support states where we can. There was also, or another one maybe about to hit soon if it hasn't already, related to mobile crisis. I mean, there's things that are coming out of the federal government because we do see ourselves as your partners in this work. But the states will also have to be thinking about what does that look like locally. And so that's, I think, on the horizon and the challenges ahead. But we intend to do this in partnership, looking at how we can leverage Medicaid and other payers. And so we work very closely with CMS on a national level. I'm looking at Wendy, this is her wheelhouse. She's like, yes. So those are the kind of things that we're thinking about, building upon the existing infrastructure and being ready to receive for when people need things beyond the call. So those are our priorities, and making sure that we are targeting and getting the people who we really believe, and we know because the data shows us that we do have communities of color that are experiencing higher rates of suicides, that what we need to be connecting with these communities. You talked about the farming issue. We have rural, remote communities that have so many challenges in just terms of access. So there's just so many things in just the infrastructure of the construct of how people live that we need to be talking about that impacts their social well-being. And so all of these things require actual investments and supports.
Okay, thank you so much. I think we have time to get to some of the audience questions, so we'll do that until you guys tell me to wrap it up. Somebody knocks me off the stage or something. Okay, Kim Williams. And Charlene F. asks, are crisis response organizations sufficiently equipped with staff and funds to meet the increase in call volume?
So this is an important question given workforce needs. It really varies from state to state. As Monica touched on, there's been unprecedented attention to mental health, unprecedented funding at the federal level. Many states have also started to invest in building out their mental health systems. So there has been not only this increased recognition, but real funding and investment to ensure that we have a broad array of services and a workforce to support that. And states and local crisis centers are taking different approaches based on their needs. One example that I will give is crisis centers really investing, ensuring that they can make their workforce whole. So bringing on a full-time workforce, covering health insurance. This is really important because it ensures that people don't have to work 2 or 3 jobs to meet their needs. It ensures that there's safety, that there's true investment in them as crisis counselors, and they can, look at this as a long-term career possibility. The other thing that I will say too is, crisis centers have seen funding and investment that they've never seen before, right? And that there has to be sustainability of these resources, not only at the federal level, but also at the state level, so that crisis centers can predict and do long-term planning around their workforce needs. So states and centers are really working together to create the solutions that are best going to meet their needs. And we've also, just been fortified by working, in partnership. You've heard that a lot. There's been a lot of collaboration between SAMHSA, Vibrant, the states and the local centers in order to work together to co-create solutions to ensure that we are meeting the needs of the people who are reaching out for support.
Thank you very much. Commissioner Tanner, and this is from Heather J. Does DBHDD or SAMHSA have plans to partner with all local law enforcement within Georgia to create a mental health task force to ensure that our first responders have the proper training to handle mental health crisis, as well as utilizing mental health professionals, including peer specialists, to help respond to crisis calls?
Yeah, I'm proud that DBHDD has been in partnership with local law enforcement for some time now. We stood up through House Bill 1013 several grant opportunities for the co-responder program that you heard a little bit about earlier. Those programs are being very successful, and that's where we embed a master level clinician, a mental health provider, in with an officer, so that when we're dispatching and law enforcement's being dispatched to the scene, we're actually dispatching that team out with the officer. It's been very successful. It's been quite a few news stories with some of our partners that are CSB levels in Georgia where you saw some stories that got a lot of attention. Gwinnett is a great example with the Gwinnett Police Department, where they were able to talk people out of hostage situations, off the ledge, literally. So very successful program. The other thing we're doing as a department, and you introduced Ms. Cherie Ralston earlier, she's actually, and I'm proud to say now, working for DBHDD, and she's going to be on our outreach team. We've stood up an outreach team that's going to be going out into the community. I'm going to be next Thursday meeting with 30 sheriffs in Southwest Georgia, where we're engaging sheriffs and becoming our partners in this conversation, working with them. So our outreach team is going to be working closely with sheriffs. We also have pilot programs that we're embedding in our jails, dealing with forensic peers and jail in-reach staff. So we're also training and helping 911 centers understand what 988 is and what 988 isn't. Obviously, 988 is not to replace 911. We don't respond. Our crisis teams don't respond to situations where there's an immediate threat or danger of someone. But teaching and learning from each other is an ongoing process. But we're very engaged with our law enforcement partners.
Thank you very much. Christine Cuellar, I got it. One of our attendees asked, Georgia's Hispanic and Asian American communities are large and growing rapidly, while Georgia's role as a top 10 state for refugee resettlement means that it is home to tens of thousands of people from all parts of the globe. In Gwinnett County, the second largest county in Georgia, 15% of the residents have limited English proficiency. In Clarkston, home to the refugee community, it's 40%. Could you describe how you will help make the 988 lines accessible to all Georgians, including the 1.4 million who speak a language other than English at home?
Yeah, absolutely. It's such an important question. As you can imagine, with the call center, we do interact with a lot of people whose first language is not English. So GCAL has a couple of ways that we assist people in that situation. Of course, 988 has a specific Spanish line where our callers can directly connect with a Spanish-speaking crisis counselor to meet their needs. For those of our callers who don't speak English or Spanish, we utilize a language line, and we're able to connect our callers immediately with an interpreter who will help them throughout the call to get the services that they need. And also, I'd like to mention that for our deaf and hard of hearing population, our community, it's really important that we meet their needs as well. So we do partner with a relay service. So when they're calling in, we can make sure to connect them immediately and get them the help that they need.
Can you talk briefly about what you're doing to advertise those services?
I believe that that's part of, it's all on the 988 website. It's part of the promotional campaign. And then all of our, of course, frontline crisis workers are very familiar with the services and can access them immediately with the calls.
Thank you very much. Kim Williams, this is from Perlugi M. She asks, or he asks, are there any developments for 988 components that will make the services even more accessible to a wider array of people?
So, we touched on some of this, and this is a top priority in improving accessibility for people. One of the things that we're focused on is really building out outreach, partnerships, and services for communities that have been historically harmed and excluded, and their needs have not been well met, including LGBTQ plus youth that was mentioned earlier, expansion of Spanish language, expansion to ensure those with functional disabilities can get access to support, supporting people from tribal nations. So you heard from Monica that we have a pilot initiative to support LGBTQ plus young people, and that is available 24/7 via call, text, and chat, and connects individuals to trained crisis counselors who are uniquely equipped to address the needs and challenges of LGBTQ plus young people. And that's in pilot phase right now. So we're going to be working on building out a permanent sub-network this year. We'll also be expanding access to Spanish language beyond calls to include text and chats. We're also working on the establishment of accessibility to video phone for those who are deaf and hard of hearing. And we're working on prioritizing meeting the needs of individuals from tribal nations, and have already started some of that work in partnership with leadership in the state of Washington that has launched the first crisis center in the nation that is solely focused on supporting the tribal community in the state of Washington. So these are just some of the ways that we are seeking to expand accessibility and ensure that this is a service that is truly for everybody.
Thank you. Commissioner Tanner, this is for you from Vita B, who asks, how can the governor's challenge to prevent suicide get into school districts and train teachers on suicide prevention?
Yeah, we continue to partner with SAMHSA, who's putting, putting out a lot of information in that area. Excuse me. We also are working in close partnership with our APEX program in our schools, where we're meeting people where they are. We have a growing, I believe we're in over 700 schools now with our APEX program, and we're continuing to young people have, like we talked about, the farming community and some of the other specific communities. Young people have their own special needs. We also, Dante runs our youth and adolescent behavioral health division. We also have a good youth peer mentor program. So we're promoting 988 to our young people. We're also meeting them where they are in their schools. And we're going to continue to grow that partnership with SAMHSA and our school system.
All right, thank you very much. Director Johnson, one of our attendees asked, since the inception of 988, is there evidence that the rate of suicide and suicide attempts has decreased?
So we're like in the 9th month of implementation of 988, and so we don't have evidence of that yet, or even a correlation. So what we know now is that we have an increased outreach. So we've talked about the stats and the data, and more people are outreaching to us. What we do think will be important is to really begin, and this is a part of future vision, landing at evaluation work, so that we'll have data around outcomes and efficacy and what happens as a result of individuals contacting the line. And I want to just reemphasize that the line itself is one thing. So we're talking about a continuum of services and activities, and at different points in which interventions and treatment can happen. The call is a support. And so I just want to talk through like other levels to get your treatment. So there's going to be, it's not quite as that, black and white as that sounds. And so, but evaluation so that we understand what is this doing to our system is a very high priority, so that we know what we need to address, what we need to fix, and so forth, and what we need to do more of.
All right, thank you very much. As we wrap up, I know some of you may have things you want to say before we wrap up. Is there anybody else on the panel who wants to mention something that kind of popped up in their heads? No? I know some of you were shy going into this, and you did really well. So, no?
Well,
okay, go ahead.
I was going to say something.
Yeah,
I just want to, again, just really just extend gratitude and just thank Commissioner Tanner, thank just the representatives that are here today, the teams, the providers, the peers, like just everybody that is working hard to make this system work. And I want to acknowledge the level of support that we have received around this work from our Assistant Secretary, Dr. Miriam Deffa-Rittman, and Secretary Becerra at the U.S. Health and Human Services Department. So this is really just important. We have the leadership that is investing and prioritizing this work in a way that has just been game-changing. So I would be remiss if I didn't say that.
Well, you got it in. I'm glad you did. We do have a closing video, and we're going to play that now, if we could.
That one single experience just completely rocked our entire world. It then changed the course of all of our lives forever. And suicide is something that, in my opinion, was reserved for the media. So many words come to mind to me when I think about what it means to be a farmer, and it does carry a sense of pride. To me, it's culture and it's heritage, and I've even said before that farming isn't just a job, farming isn't a career, it's an identity. In my senior year of high school, it started out sort of like no other. The general rule of thumb was that we would try to have all of our strawberry plants in the ground in the fall time, and then hopefully by mid-November, Thanksgiving time, we would start picking through some of our first strawberries. And actually had the unfortunate loss of my dad my senior year of high school after we had a crop disaster that year and lost him to suicide. That one single experience just completely rocked our entire world. It then changed the course of all of our lives forever. And suicide is something that, in my opinion, was reserved for the media. It was something in the headlines that you saw in the evening news or in the morning newspaper. It wasn't until it really happened to us that it impacted me and my family and our entire community. And so Mind Your Melon finally came about approximately a year ago when my wife and my family and I, we were talking about, what this actually was. With a stoic industry, especially a super traditional conservative industry like farming and ranching, we're like, we'll just try to encourage people, make it a little bit more light than just talking mental health and farm stress, and just remind people to mind their melon And that's sort of been the premise of it. We've just been wanting to gradually chip away at that surface level and destigmatize the topic of overall well-being. And so for anybody struggling, you deserve to take care of yourself. You have the time to take care of yourself, and it does not make you any weaker, less strong to want to take care of yourself or to admit that you might need some help. There's always somebody here within our support system or within our network, and that's the main thing. Just remembering that each and every one of us matter, and there's always somebody to turn to.
Well, let's give some
That
applause for
one
that.
single experience just completely
How
rocked our
nice of,
entire world.
Marshall Sewell
It
and to talk
then
about those
changed the
things and
course
to
of all of our
develop
lives
Roger
forever.
So
And
thanks for
suicide
that.
is something that, in
I
my
think we've all
opinion,
learned a lot
was
today.
reserved
It
for
sounds like
the media.
It's been a year of. It's only been 9 months. It's almost a year of learning, of growing, and looking forward to what other things you can do. But I personally am just grateful for all of you and the work that you do, and what the future holds for all of us because of what you do. So I want to thank you for that, and thank you all in the audience for being here, for leaving today and spreading the word about 988, and for us
So
just
many
seeing
words
a
come to
better
mind
future
to me when I think about what it means to be a
this is,
farmer, and
underway,
it does
all
carry a
the work
sense
that
of
you're
pride.
doing.
To me, it's
thank you all for
culture and it's
coming.
heritage,
I think that wraps
and
it all up. Thank you.
I've even said before that
Round of applause
farming
for this
isn't
wonderful
just a
panel.
job. Farming isn't a career. It's an identity. In my senior year of high school, it's